Today's lecture will cover medication administration. The radiographer's role during medication administration includes checking the allergic history of patients, preparing the medication for administration, verifying patient information, assisting the physician, and monitoring the patient after the medication has been delivered. A standing order are a set of written directions for a specific medication or procedure signed by a physician and used only under the specific conditions stated in the order. The chemical name is the generic name of a drug. Medications are substances which are prescribed for the treatment that produce therapeutically useful effects. Drugs are substances used in diagnosis, treatment, or disease prevention. Pharmacokinetics is the study of the way the body processes a drug and includes how drugs are absorbed, reach their site of action, are metabolized, and exit the body. Absorption is the process involving the movement of a drug from the site of administration into the systemic circulation in order to provide a desired effect. Medications are absorbed by different tissues differently, such as blood, mucus, and dermal layers. Distribution is the means by which the drug travels from the bloodstream to the target tissue and site of action. Drugs work more quickly in areas with an abundant blood supply, such as the liver, heart, brain, and kidneys. Metabolism is the process by which the body transforms drugs into an inactive form that can be excreted from the body. This usually occurs in the liver. Excretion is the elimination of drugs from the body after they have been metabolized. Usually this occurs by the kidneys, intestines, lungs, breast milk, or endocrine glands. If kidney function is impaired or if the patient is dehydrated, a toxic or poisonous effect can occur. Pharmacodynamics is the study of the effects of drugs on the normal physiological functions of the body. An agonist is a drug that produces a specific action and promotes the desired result. An antagonist is a drug that attaches itself to the receptor, preventing the agonist from acting. An antidote is the specific drug that treats a toxic effect. An idiosyncratic reaction is an over or under reaction to a drug or an unusual reaction. An allergic reaction is when a patient has been sensitized to the initial dose of a medication and develops an allergic response. An allergen is a substance which a sensitivity has been established. Drugs taken together have an additive effect that may go far beyond the desired outcome. These are known as synergistic. Osmolality is the total number of dissolved particles in solution per kilogram of water. It is used to classify intravenous contrast agents. The least toxic is barium sulfate. It is not absorbed by the body. Non-ionic water-soluble contrast is low toxicity, it has fewer adverse reactions, but it has a higher cost. Anaphylaxis is the rapid onset of severe respiratory or cardiovascular symptoms after ingestion or injection of a drug, vaccine, contrast agent, food, or after an insect bite. It is a severe allergic reaction, which is also known as shock. Symptoms include dysphagia, itching of the palms and soles, constriction of the throat, shortness of breath, wheezing, and bronchospasm. Symptoms for respiratory reaction include sneezing, dyspnea, and asthma attack. Some frequently used medications. Benadryl is typically used to treat allergic reactions. Alcohol and betadine are used as antiseptics. Dilantin and Valium are used for seizure disorders. Analgesics are used to relieve pain without causing a loss of consciousness. additive and Valium can be used as sedatives and tranquilizers to have a quieting effect. Antagonists counteract the effects of sedatives and analgesics. Local anesthetics eliminate the sensation in a local area. A paralytic can cause skeletal muscle relaxation, and a hypoglycemic can help to control the level of glucose in the blood. The drugs that are commonly given: for bradycardia, it's typically atropine; arrhythmias, cortisone; for seizures, Dilantin; for allergic reaction, Benadryl; a diuretic for edema, Lasix; an antihistamine for allergic reaction, nitroglycerin for angina pectoris; a vasodilator for angina; epinephrine for bronchodilator, and epinephrine also for anaphylaxis and cardiac arrest. The directions for administration come from the physician and regard the medication dose, route, time, patient, and documentation of all of the above. The route of administration is provided in the package insert. There are 6 rights of medication administration: the right dose, the right medication, the right patient, which is confirmed by the name and date of birth, the right time, the right route, and documentation. Various time frames can be used for medication administration. For every hour, we use the letters QH. For as needed, we use the letters PRN. For every 2 hours, BID. For every 3 hours, QID. For once daily, we write daily. When we want nothing by mouth, then the time frame is typically indicated with the order. It is NPO. The recommended dosage is typically in the packaging, but you will want to confirm with the physician for each patient. Dose divided by the strength equals the volume, and dose divided by the kilograms times the weight in kilograms equals the total dose. Routes of administration include the following. Topical would be the surface of the skin. Sublingual or buccal would be in the oral cavity. Parenteral bypass the GI tract and are injected directly into the body by IV. Intrathecal go into the spinal cord. Intradermal go between the layers of the skin. Subcutaneous go under the skin. Intramuscular go into the muscle. And intraarterial requires percutaneous access to an artery with a catheter placement. An ampule is a glass container with a narrow neck that is opened by breaking. It is a single-use vial. Infiltration is leakage into the surrounding tissue, also known as extravasation. This can cause hematoma, scarring, and tissue death. Prior to medication administration, you need to review the patient's blood chemistry, any allergies, and their history. The normal BUN is 8 to 25 milligrams per 100 milliliters. The normal creatinine for males is 0.6 to 1.2 milligrams per deciliter. For females, it is 0.5 to 1.1 milligrams per deciliter. The GFR is the glomerular filtration rate and should be greater than 60. You may need to hydrate the patient prior to the injection of intravenous medications because toxic effects are more likely to occur when patients have insufficient fluid or are dehydrated. Charting of medication administration involves the contrast agent name, the volume administered, the route of administration, and the date and time of administration. In summary, be aware of the responsibilities during medication administration. Clarify, verify, and document. Continually monitor the patient. and be sure to use sterile procedure when necessary and your PPEs.